honestly, the estrogen hormone is not always our friend, it's our hormone. So there are lots of theories as to why it disproportionately affects African American and Black women. Is it the things that we eat and consume? However, it is also very much multifactorial. So there is a genetic component that we should not ignore. There also are components in the things that environmentally, like our vitamin D deficiency, our melanin blocks the sun. So women of darker complexion, people of color tend to have less vitamin D. And there is a direct link that the research has very well documented between vitamin D and fibroids.
When we talk about why Black women are disproportionately affected, what we break it down to really is the trauma of racism, creating a disproportionate amount of trauma that specifically causes a radical lifestyle impacted by cortisol. And cortisol is very important in our lives. However, when it is radical consistently, the inflammation that causes, depending on where and how it's affecting our bodies, it can be represented or manifest itself through fibroids tumors, through cysts, through high blood pressure, like many different pain, arthritis, even mental health issues.
So estrogen is really a big factor also in fibroids. It's one of the biggest stimulators of that tissue growth. And when you tie it back into diet, you see like in African nations when they eat pounded yam and things like that. So you see a higher twin rate in those countries. And you also see fibroids at earlier ages and larger in size. I did a medical mission in Ghana and I had many women in their 20s and they had fibroids all the way up to their diaphragm. And you would really think that diet may play a role as stressors are there, but in a different capacity than we see in America. But the fibroid tumor growths seem dramatically different.
And Dr. Tiffany, I'm so glad that you brought up the fact of our diet and our nutrition and how it plays a part in a very organic way, because a lot of times the dialogue or the depiction that many will make about why fibroids affect Black women so much is because of obesity, right? Mm-hmm. But we have seen fibroids in women that are underweight, right? That are tiny.
Yes.
Right? So not just obesity. So I'm glad that you made that very, very specific highlight that it has a lot to do with our diet and our estrogenation, and just honestly, the estrogen hormone is not always our friend. It's our hormone, we'll claim it, but it's not always our friend to some of the ailments. And adding in the inflammation, the vitamin D deficiency, the stress, all of that compiles why it affects African American women so much and Black women so much.